Hi there, it's Nikki from South Lane Dental, member of the hygiene team. I'm here today to talk about cleaning between your teeth. So some of you may use floss, some may use brushes, some may use both. The idea is we want to do this every day. If we don't, bacteria builds up in the areas between our teeth and it leaves us open to getting inflammation. If your gums get inflamed, it will mean that they will bleed when you clean between or when you brush. So the best thing we can do is clean between them on a day-to-day basis to stop that bacteria from causing the inflammation. If you get a bit of bleeding when you're brushing or flossing, it means that you just need to do a little bit more. So most important thing is to make sure that we clean between the teeth every single day. Now some of you may have floss. The idea with floss is you use that in those tighter gaps. Some of you may have the interdental brushes, so you can get a range of different coloured interdental brushes. Different colours indicate the different sizes, so you'll find you'll have some really nice big ones and then you'll have some little ones as well. Use a brush that feels comfortable to use between the teeth, so you don't want to be forcing it, but you need to make sure you have that bit of friction. So for bigger gaps, you just need that bigger brush. Obviously a pink brush in there, you're just not even going to touch the sides. So when you're using your interdental brushes, the idea is you push the brush between the teeth, rubbing it slightly against the gum. You need to make that contact with the gum because this is what we're trying to clean. If you look at your fingernail, you have this gap between the fingernail and the finger. So this crevice is very similar between your gum and your tooth. There's a couple of millimetre gap there. So the idea is we use these brushes to clean between that gap. So make sure that you go in between every single gap. Now for the tighter gaps, as I said, you'll need to use a smaller brush. So place the brush down by the gum, backwards and forwards 3 or 4 times, rinse the brush and then move to your next gap. Okay, for the back teeth, you may find it beneficial just to slightly sort of curve the brush. So quite often I'll curve it around my finger and thumb. It then gives you better access for getting into the back of the mouth. What you'll need to do is maybe just pull your cheek out the way with your finger, and you'll need to just feel where those gaps are. On another point, look in the mirror when you're cleaning your teeth. I know it sounds really silly, but if we look, you'll be surprised actually how much you can see in your mouth. Look in the mirror, pull your cheek out, get into the back, feel where those gaps are and push the brush in and out. Once you've finished, rinse your brush off and you can cover it with your cap. Another point with the cap, really handy, put it on the other end. Gives you an extendable handle. So that again just makes it easier for getting into the back teeth. So interdental brushing, backwards and forwards between each gap, making sure that the TP is big enough. This TP isn't big enough for the model. If you do happen to have brushes that aren't big enough, just rub it against one side and then rub it against the other. And then when we see you in South Lane Dental, we can recommend which size brush is best. So you've got your interdental brushes for those bigger gaps. For those tighter gaps, you'll need to use some floss. You can get standard floss, you can get floss picks. Now I apologise, I don't have any floss picks at home, but the idea with a floss pick, it has a tiny little bit of floss on the end of a little handle, and that way you've got a nice bit of tension to be able to get into some of those teeth. So I know a lot of you use the floss picks, you can reuse them, that's absolutely fine. With standard floss you'd obviously chuck that out. Now with your floss you need to wrap it around your fingers so that you get that bit of tension. The other thing you can do is you can just tie your floss in a bit of a loop, and that can make it a little bit easier to hold when you're flossing. So it just depends on what you prefer. So you could tie it in a loop and then it just saves you having to wrap it around your fingers. So I prefer to wrap mine around the fingers, and the idea is with floss, now I'm going to show you on the bigger model, the idea with floss is that you get the floss between the teeth and then down into the gum. Now I'm going to do it on one that doesn't have a massive amount of gum disease. So get the floss between the teeth, down, and then you're curving it like a C shape, okay? So back and front, curve it round the tooth and take it slightly into that gum margin. 2 millimetre gap, you'll find that that floss will just disappear under the gum. That's good, that's where it's supposed to be going. See it disappear under the gum and you bring it back out again. Okay, so it's an up and down motion between each of the teeth. Now I'll show you on the model, because obviously that model has large spacing, so a TP brush would be better. It's just I can't get very good focus on this model, I'm afraid. But the idea is that you get the floss between the teeth. Now you've got a contact point here, so there's a point where the teeth are quite tight together. So with that you need to shimmy your floss, wiggle it to get it through that tight contact point. The contact point, then you'll find your floss will go past that contact point and it will snap down a little bit into the gum. Try and control it with your thumb so it doesn't snap into that gum margin. Your gum comes to a triangle, so go one side of the one triangle and then go the other side of the other triangle of the gum. So you're going down both sides of the teeth. So do one side first, down, C-shape curve it, back up. Okay, do that a couple of times. Then you can go down the other side of the other tooth into the gum margin, back up and out, and pull your floss out. Then ideally wash the floss or move on to your next bit. So when you become really good with it, you can just move on to another fresh bit of floss, or if you've got your loop, just move it around. Okay, so don't worry if your floss snaps in, just try and control it. That's natural. There's a natural contact point where the teeth meet. Okay, so if you imagine here, you can see where my fingers are meeting, and then there's that gap at the bottom. That's what we're trying to clean. When you've cleaned between your teeth, I would recommend, ideally, if you clean between your teeth first, you can then brush them after, so any debris you remove. Now, some patients comment, I don't see anything coming out on the TP brush or the floss, so I just do it once a week. We can't see bacteria, so ideally we do recommend that you do it every day. If you're running out of your TP brushes or your floss, please do have a look on our blog. We've now set up a service where you can have your oral hygiene products delivered direct to your door. So please make use of that. If you have any questions, please don't hesitate to email and one of us will get back to you. Now everyone, take care, keep looking after your teeth, and we'll see you very soon.